Hey everybody, John Robinson, the hospice guy. Tonight we're going to talk about your hospice team and what their goals are and what their duties are. So let's start with the registered nurse or the LPN. You know what? Our goal is to make sure that the patient's symptoms, medications, medical supplies all meet the needs of the patient and or their families. You know, we take the blood pressure. We may be in there for 30 minutes to an hour depending on what's going on or not going on with the patient. But even more importantly than the physical aspect of our patients, the nurses are also responsible for the spiritual well-being, the mental well-being, the mind well-being of every patient and actually every caregiver and family member. You know, it's not just that we are in charge of that, we work as a team. And with that said, we will move on to the home health aide, where her goal is to keep your patient clean. The home health aide actually is my eyes, my ears. They bathe the patients. You know, when there's something wrong, they know the patients better than a nurse does. They're such a vital part of what hospice is. You know, they're also there to listen. They're also there to talk. And like I said, they're my eyes, ears, and nose. And without my aides, believe me, I'd be lost. There's the social worker, who's also there for the psychosocial needs of the family of the patient. Someone to talk to. If you have questions about insurance, such as Medicare, Medicaid, veteran benefits, county benefits, state benefits, that's what the social worker's job is to help guide you and support you on your journey through all that red tape and paperwork and all that stuff. But they are a great, great resource. So don't ever hesitate to ask your social worker a question. We also have a chaplain who is there to meet your spiritual, religious needs, if you so choose. He or she is also a great source of socialization, someone to talk to. You know, you don't have to pray with the chaplain. Maybe you just want to listen to some music. Maybe you just want someone to play cards, talk to, whatever the case may be. Your needs are what we are there for. So if you don't have any spiritual needs that we need to meet, then that's okay. All these visits, you could either limit the social worker or chaplain to one time, and that's it. So we'll see how that goes. Also on our team, there's a bereavement counselor who, after your loved one passes, will follow up with you or a loved one for 13 months to make sure that your grief isn't overbearing, isn't stifling your growth. We have volunteer coordinators that also coordinate the volunteers that may come into your home to either like sit with your patient or family member or loved one. You know, it's really, really important to utilize your whole team. And once every other week, our team gets together and we talk about every patient that we have in case there's any needs that maybe I have missed or someone else have missed. So when you have 3 or 4 sets of eyes going in there every week, it covers a lot of bases. And you know, I can only talk about myself. When you're picking a hospice, make sure you get information and ask people around you if they've used this hospice or that hospice. You know, when your loved one's dying or in the active process of dying, the nurse should be there every day. The aide should be there every day. You know, the social worker should be there once a week along with the chaplain just to support you. And if you don't need that support, fine. You can just say, I don't need that at this particular time. You know, if your nurse isn't calling you after hours to make sure that you're okay or your loved one's okay, or if there's anyone that you need, or even if the aide makes an extra visit just to check in on you, even after she's been there earlier in the day. Those are the hospices that you want. Those are the caregivers, the nurses that you want taking care of you and your loved one. So that's just a brief touch upon what we do as a hospice team. And it definitely is a team approach. So with that said, John Robinson, aka the Hospice Guy, may you be blessed and have a good evening.